All right, it looks like our numbers are leveling, so we're going to go ahead and get started. Welcome to today's Physical Activity Alliance webinar. I'm excited for this one on the latest report card on children's physical activity in the United States, which was just released earlier this month. The report card is an initiative of the Physical Activity Alliance and a component of the National Physical Activity Plan, which you can learn more about on the Physical Activity Alliance website. This webinar is being recorded and can be found later on the YouTube channel of the PAA and on the PAA website. Send questions at any time into the Q&A box. We will collect these and address them during the Q&A session at the end of today's presentation, time permitting. Without further ado, I'm going to turn this over to our host and chair of the Report Card Committee, Jordan Carlson. Dr. Carlson is a professor of pediatrics at Children's Mercy Hospital and the University of Missouri, Kansas City. Dr. Carlson, please take it away.
Great. Thank you, Iana. So good morning and good afternoon, everyone. Thanks so much for choosing to spend your time with us for this next hour. We're going to be presenting a little bit on the report card, and then we're going to move into a panel discussion where we'll hear from some of our report card members, and we'll be able to get to some of your questions if time permits. So please do put those questions in the chat along the way today during our journey. So one of my goals for this webinar is to show you why children's physical activity in the U.S. has never been a more important topic than it is now. So during this journey, we'll hear from a fantastic group of presenters from the Report Card Advisory Committee. We have Dr. Amanda Staiano, who's an Associate Professor of Population and Public Health Sciences at Pennington Biomedical Research Center and Louisiana State University. We have Dr. Rebecca Hassan, an associate professor in the School of Kinesiology at the University of Michigan. Dr. Russ Pate is a professor in the Arnold School of Public Health at the University of South Carolina. And finally, Dr. Jane Greenberg is the North American Chair for the International Sport and Culture Association. I want to first recognize all the members of the Report Card Research Advisory Committee. We were truly fortunate to have such an outstanding group for this project. Each of these experts played a critical role in the development of the report card, bringing their vast knowledge in children's physical activity to the project. The report card was made possible through generous support from both Children's Mercy Hospital, Kansas City, and the Center for Children's Healthy Lifestyles and Nutrition. And finally, I want to recognize our fabulous team at Children's Mercy, shown here at the bottom of this slide, for all of their hard work in ensuring the success of this project. The new report card is particularly special to me and to our group because it marks a decade of U.S. report cards. It was 10 years ago that the first U.S. report card was published. It was pioneered by Dr. Peter Kaczmarzyk at Pennington Biomedical Research Center and has continued since then, where now we're on our 5th iteration of the report card. With the 2024 report card, we were excited to be able to reflect on this past decade of report cards. And we made this a theme that was incorporated throughout the report card. You can access all of these report cards, including the latest 2024 release, on the Physical Activity Alliance Move With Us website. The purpose of the report card continues to be to synthesize the most recent national evidence on children's physical activity. Several data systems track children's physical activity in the U.S., and what we do is we integrate the data across these systems so that they're all in one place. And synthesizing these data, we aim for the report card to serve as an advocacy tool for local and national advocacy organizations, policymakers, community leaders, health professionals, researchers, and families. The 2024 report card integrated data from over 10 national surveillance systems and other data sources. These include the NSCH, NHANES, and YRBSS, among many others. So what our committee did is we established 11 key indicators related to children's physical activity, and then we assigned a letter grade to each indicator based on this rubric shown here that's been used by over 50 countries across the world. Each section of the report card focuses on a different indicator and then provides a summary of the latest national evidence on that indicator, as well as changes over time. And then we also have key insights and recommendations within each section that are provided by our Research Advisory Committee. In the 2024 report card, we incorporated 3 new sections, and these ended up being some of my favorite sections of the report card. For example, the new government and policy section provides a fantastic overview of how local and national policies shape physical activity opportunities in our communities. I encourage you to check those new sections out as when you're checking out the report card. The grades for the 11 indicators in 2024 ranged from B- to D-. We were unable to grade 3 of the indicators due to a lack of available data, and this points to gaps in our research, our national surveillance systems on these data. So these are gaps that we hope will be filled over time and that we're advocating to be filled. A popular feature of the report card has been the How is your state doing section, which allows you to gauge how your state compares to the national average and to other states. I won't say which states are at the bottom, but I encourage you to check out this feature and share it with advocates in your state. Now I'm excited to turn it over to Dr. Staiano to share more information about key indicators from the report card. Dr. Staiano, over to you.
Thank you so much, Jordan, and thanks everyone for joining us today. What I'll do now is, for the next few slides, share with you some of the key indicators and grades that were assigned. And I encourage you after this call to read through the full report card because you'll find a lot more information about the data sources, as well as recommendations and insights like Jordan shared. So I'd like to orient you to these results slides. First, you'll see the section at the top. For this is overall physical activity. And then we describe to you what the main indicator is. How do we operationalize that? So for overall physical activity, we are reporting on the percent of 6 to 17-year-olds who meet the physical activity guideline, which is 60 minutes or more of moderate to vigorous physical activity daily. On the right, you see the grade. In this case, it is a D-. That D- has been consistent across all of the report cards over the past decade. And then in the table in the figure, you'll see the current data. These are the data that were used to inform the grade this year. This is from the National Survey of Children's Health. And what you see is, for the most recent data, 20% of 6 to 17-year-olds are meeting the physical activity guideline. So that's 1 in 5. We're also showing you looking back. So at the last report card, what did the cycle of data show then? And you can see in the last time, 23% of 6 to 17-year-olds were meeting the physical activity guideline. So as you can see, in this case, for overall physical activity levels, it appears that things are, in fact, getting worse. And actually, at that 20% benchmark, we are quickly getting close to that F grade. And so this is something that we really want to keep an eye on. And what really overall the physical activity report card is intended to do is to see how much activity are our kids engaging in. And so if we'll go to the next slide, we can move on to the active transportation section. Similar grade here, a D-. The way we operationalize this is the percent of 5 to 14-year-olds who usually walk or bike to school. And this is from the National Household Travel Survey. So based on the most currently available data from 2022, 10.3% of 5 to 14-year-olds are usually walking or biking to school, according to that survey. So just 1 in 10. And again, looking back, that was slightly higher, 12.7%. So we're again seeing that these are getting worse, that there's a decline in this indicator. So we can move on to the next. Next is organized sport participation. We recognize that sports is a very important way, an outlet for children to obtain regular physical activity. This received a grade of C-. And the way we operationalized is the percent of 6 to 17-year-olds who participate in sports, based on the National Survey of Children's Health, so the parental report data. The current data available show that just over half, 51.1% of 6 to 17-year-olds are participating in sports. Once again, for this indicator, it looks like the data are going in the wrong direction because looking back just a few years ago in 2016, 58% of children in this age range were participating in sports. So moving on to the next is sedentary behavior. Sedentary behavior received a D-. This is defined as percent of 6 to 17-year-olds who engage in less than 2 hours of screen time per day, which aligns with international recommendations. So for our current data, this is coming from the National Health and Nutrition Examination Survey. Only 20% of children and adolescents in this age range report engaging in less than 2 hours of screen time per day. And this perhaps had the biggest change. Looking back at data from just over a decade ago, just over half were meeting that guideline of less than 2 hours a day. And now we're down to only 1 in 10. So this as well is getting worse. Now let's move on to the next one. And this is the school. School section received a D-. This is the percent of high school aged youth who attend physical education classes at least 1 day per week. And these data are coming from the Youth Risk Behavior Surveillance System. So from the most current data from 2023, just under half, 49.9% of youth in high school are attending PE at least once per week. And again, we see a slight reduction, getting worse compared to about a decade ago, where about 52% were participating in PE at least once per week. And next we'll move to community and built environment. And we chose to include a few indicators here, so I'll walk you through these. This received a grade of a C+, which is actually slightly better than last report card, which I believe gave community a C. So the indicators include percent of 6 to 17-year-olds who live in a safe neighborhood, a neighborhood with sidewalks, and a neighborhood with parks or playgrounds. So different parts of the built environment that would be conducive to physical activity. So if you look at the circle on the left for current data and you look at the outer blue line, 66.2% is the percent of children and adolescents who live in safe neighborhoods. As a comparison, that's slightly better than last time of 64%. Next, if you look to the middle purple line, you'll see that 75.8% of youth live in a neighborhood with sidewalks, which again is slightly better than last time of 75.0%. And then finally, looking at youth who live in a neighborhood with parks or playgrounds, that went down slightly to 75.8%, shown in the green line, compared to 76.1% looking back. The other item that we really wanted to point out here, and this will feed next into Rebecca's presentation, is the percentage of children and youth who live in a safe neighborhood, looking at this by racial and ethnic group. And this is informing our grades as well when we identify that there are significant health disparities in some of these indicators. So the white and non-Hispanic children and youth, of those, 74.2% live in a safe neighborhood based on parent report. This is quite different, however, for other groups. For Hispanic groups, 57.6%, for Black non-Hispanics, 55%, Asian, 63%, and other non-Hispanic, 62%. So this identifies an area that needs attention. So now we can move on to the next slide and the next presenter.
Thank you, Amanda, for that great introduction to some of the disparities that we are seeing in this year's report. When we talk about health equity or even health disparities, when we're looking at the research, there's 3 main important things that we want to take into consideration. One is, and I would say to remember this, is think of the 3 Bs. First, we want to detect differences. Then we want to try to understand the determinants or factors that are contributing to these differences. And then finally, we want to develop solutions. So my 3 slides are going to go through those 3 different dimensions of health equity research to give us a little bit better understanding of how is exercise or physical activity being socially patterned by race and ethnicity in the United States. So as you look at this graph here, you can see all of the different indicators that Amanda just mentioned: overall physical activity, sedentary behavior, sleep, sports participation, school and built environment. And the blue bar tells us the non-Hispanic white group, yellow bar is Hispanic, Black is in red, Asian is in orange, and other is in green. The gray bar indicates the total average. So as you see the gray bar that covers all 4 or all 5 bars, that is the total. And so if you pull apart the data, which is very important to do, we can see or understand that there are differences by race and ethnicity across all of these different indicators. What is consistent is that non-Hispanic white children are more likely to reach the 60-minute physical activity recommendation compared to any other racial and ethnic group. And Black and Hispanic or Latino children are less likely to meet those indicators on just about every indicator. Less likely to hit the recommendations for physical activity, less likely to meet the sleep goals, and less likely to meet the sedentary behavior goals. So as we have detected these differences, as you'll see on the next slide, it's important to understand what are some of those determinants or factors that are contributing to these differences. On the next slide, you'll see some of what Amanda was talking about in terms of, she mentioned safe neighborhoods, but if we go back to our classic Bronfenbrenner social ecological model, we can see this is a review that was conducted a few years ago, looking at the different determinants at each level of a child's life. So thinking about family and school, thinking about the community, policy levels. At these different levels, we see different supports or barriers to engaging in physical activity participation in Black and Latino or Hispanic youth. If we go through this individually, we have documented these are more local, but they can be scaled up at a national level. Reductions, there have been reports of reductions in parent involvement in schools, low parent support. So thinking of when we talk about developing solutions, how might we be able to engage parents to help support their children's physical activity? We know that there are socioeconomic barriers to physical activity and even cultural barriers, as in some communities, as we talked about in the report card, may prioritize academic achievement over physical activity, which may be great for school education, but not so much for participating in physical activity. We know that there are disparities in neighborhood recreational facilities, as Amanda mentioned, having access to parks, but they are perceived as unsafe, not having good sidewalk conditions or physical disorder, meaning trash or graffiti that contribute to those perceptions and realities of unsafe neighborhoods. And then looking at the parent level, thinking about how parent participation in physical activity may influence physical activity behaviors. What are the equipment or access to equipments in the home, media devices, as we heard earlier, and a big one, access to school resources such as PE, recess, and activity. You will note in the report card that students or communities of color, it was reported that they have higher access to PE, but the quality of the PE, unfortunately, we weren't able to measure in this report card, but previous researchers, including Jordan, has noted that children attending under-resourced schools are more likely to have PE that does not have a certified PE instruction, or they don't have it every single day. So the quality of the PE can be lower, that then leads to lower physical activity. In the panel is that there are solutions being developed that put health equity at the forefront of the conversation. So thinking this is a model that was developed by the CDC Foundation to where addressing those root causes that we discussed in the previous slide is really important for thinking about policy, systems, and environmental approaches to promoting youth physical activity and promoting equity. So how can we use or lead with community-led approaches to prioritizing the community's need to promote physical activity? What are the different place-based initiatives that we can point to that improve both the built environment and the social environment? How can we help to support parent physical activity, workforce development, but also thinking about teachers, nurses, pediatricians. How can they also support youth physical activity? How can we continue to have data-driven ideas that help to promote physical activity? What are the gaps in the data that we have? So as you saw on the previous slide, we only had 5 racial categories, or excuse me, 4 racial categories, but we don't currently have data on MENA population, Middle Eastern, North American populations. You didn't see any data for indigenous communities. So how can we expand our surveillance to include all children so that we know how to effectively support their physical activity behaviors? And then what are the investments that we need to make in order to have long-term sustainability of physical activity across the K-12 children, adolescent age group? A recent paper that was published in JAMA just a few months ago, while it focuses on socioeconomic disparities in physical activity, it reports that if we were able to eliminate the socioeconomic disparities in physical activity, we would have a $15 billion savings in healthcare savings and disease outcomes if we were able to close that gap. More research on understanding of how can we close the race ethnicity gap could also lead to even more benefits. So the return on investment for promoting equitable physical activity, the case is there, and now we just need the political will to make it happen. I'll turn it back to Jordan, who will bring us to our close.
Excellent, thanks. So while I'm going to invite our panelists all to come back on screen, and then we have a few questions we want to ask them. We're also getting some great questions in the Q&A, so thanks for that. Folks who have questions, please remember to put it in the Q&A rather than the chat. It's just a lot easier for us to respond in the Q&A. I'm just going to quickly, while folks are coming back on camera, just quickly address a couple of the questions about data. So I didn't go into a ton of detail in the data, but in the report card, it's very clear what data sources different things come from. And so we're synthesizing national data. So we're always focused on data that are come from multiple parts of the country, most often from national surveillance systems that are generally led by the United States Department of Health and Human Services. But then we also incorporate other types of national data when we can, that different groups and foundations and things are collecting. One of the limitations of the data is that they're always at least a year, sometimes 2 years old by the time they come out. So the data get collected for the National Child Health Survey, for example, and then after they're collected, it takes about a year to release those. So that's why you'll see a lot of the latest data is often from 2023 or even 2022, and in some cases even 2021, and that's a limitation of a lot of the national data sources. And then the historical data that we're comparing to differs for different indicators because the data come from different sources, right? So the National Survey of Child's Health is conducted in different years, say, than the YRBSS, and compiled in a different way. And so the questions can change over time. And whenever a question changes or a new question is added or removed, we are not able to make a comparison. So there was one question about some of these indicators or the way the things are being tracked changing over time. And that is an important limitation in national surveillance data. But in all of the changes that Dr. Staiano was presenting and that are shown in the report card, those are all based on the same data source, same data system, same questions that are asked in those systems. So it's more likely that when we're seeing changes that is, it's from that same question, same data source. But again, there's a margin of error, right? So these smaller changes are things that we think are more important to watch closely over time to see, do these small trends continue? The larger things, though, like the declines in sports, and also somewhat the declines in physical education participation, those are generally going to be what we perceive outside of this margin of error, and meaning that those are pretty real and concerning changes. And so hopefully that answers some questions about the data sources, some of the limitations and things. There's also limited data on some of the community and environment. So again, most of these data that we're presenting tend to be reported data, self-report or parent report data. And within each of the sections of the report card, you will find a lot more data points and information. So we're presenting some of the key highlights here. The community and built environment section, for example, also looks at complete streets policies across states in the United States. It does incorporate some information from the Environmental Protections Agency smart location and walkability data. Some of those are hard to compare over time, but can still provide some useful information here. So I encourage you to look at some of the other levels of detail. We don't always have changes or temporal data for some of these other things, like I mentioned, complete streets. However, when those do exist, we try to incorporate that information, whether there's temporal data or not. So please keep the good questions coming. And while we're getting ready to field a couple more questions, I'll ask one of my first questions to the group here. So as members of the Report Card Advisory Committee, what are your thoughts on the latest data that were summarized here in the report card? And I'll open that up to anyone, so please feel free to just jump in.
I'll go ahead and start the conversation. It's disappointing to see we haven't moved the needle as far as we could move the needle. We've been talking about the need to address physical inactivity among our children and youth for at least the last decade. And the message has been out there, it's been amplified, but we still haven't been able to move the needle more. So we know that we have work to do. It's going to take collective action. And I think that we do have some models that we can discuss in a little bit, but it's just a little disappointing that we're still talking about the need to move the needle further than we have for the health and wellness of our youth.
One of the biggest changes I saw is the change in sedentary behavior and specifically screen time. So as you'll recall, about half of the youth were meeting that guideline of 2 hours or fewer a day just a few years ago. And now that's gone down to about 25%. So that's something we really need to think about. Perhaps, the change during the pandemic and shutdown, but just continues, screens are continuing to take over the lives of children. And how can we fight against that and make sure that it's not displacing physical activity opportunities, and making sure that our children are finding fun ways, to do things outside of the screens that are always in our pockets and in our hands.
We have the ability, especially when we talk about children and youth, with 55 million children attending schools, and they're there for at least 7 hours and 20 minutes a day, that we have the opportunity to use the school environment, the before, during, and after school programming, to increase physical education policies, to add recess in addition to those policies, to provide intramural sports for those that don't make sports teams. And it's equitable access. It's free during the school day. But when we talk about increasing the need for youth sports at the school site, we need to do away with the pay to play.
Great, thanks for that thoughtful discussion. So another question, getting to kind of strategies, right? Getting more into that area where you're going, Jane. This question is for the whole group. So there's so many outstanding efforts that we know are happening to support children's physical activity. And so what are some of the wins that you're seeing, either at the local or the national level?
Well, Jordan, this is Russ. I'll respond to that. I don't think any of my colleagues have mentioned the indicator in the report that had the highest score, which was B- for early care and education settings. And I do think that, that this is very encouraging and reflects major changes in policy and practice in that setting. My research group has been working to study physical activity in kids and childcare for a long time. And, when we started, there essentially were no policies or, established mandated practices to promote physical activity in early care and education settings. And that has changed dramatically. Across the several report cards, early care and education has been handled inconsistently. It's sometimes been included in the report and sometimes not. And that's probably understandable because there haven't traditionally been surveillance systems to evaluate that setting. That changed recently, and that enabled us to include, I think, a good analysis for this setting in this particular report card. Since we did the previous report card, both CDC, the Centers for Disease Control and Prevention, and USDA, U.S. Department of Agriculture, have implemented surveillance systems to evaluate policies and physical activity promotion practices in childcare settings. And the results of those recent surveys indicate that that there's been real progress there. I think we can't track it serially because these are new systems, but realistically, these are probably positive developments in the last decade or so, during which time we know many states have implemented policies that are there to reduce the risk of children developing overweight. And in that effort, many states have adopted policies for early care and education settings that are intended to promote healthy eating and physical activity. So I think there is a notable positive here in the report.
I think other local wins, if I can brag on my state of Michigan, is that we have made a concerted effort here to really integrate physical activity into the classroom. So what Jane was talking about earlier is that we have the overwhelming majority of our students in school settings for most of their waking hours, and they're in a classroom and they are engaging in prolonged sitting in those spaces. And so there's an excellent opportunity to integrate physical activity into that space. And so the University of Michigan has been partnering with the Michigan Elementary Middle School Association, Michigan Regional School Health Coordinators Association, Michigan Department of Education, Michigan Department of Health and Human Services, to understand what are the barriers to implementation in that classroom, and then what are some of those supports that we can give to teachers, administrators, to really create a strong infrastructure so that physical activity is seamless in the school environment. We also, our governor issued a Michigan Moves Month. This was in part initiated by Michael Stack, who's the incoming president for the Physical Activity Alliance. And so, no pun intended, at least in the state of Michigan, there's a lot of movement around physical activity. And this, particularly after the pandemic, when we had an opportunity to see what does it look like when our children don't have an opportunity to be physically active. And it doesn't look good. We know that a lot of our health indicators declined substantially. Our kids were like Kevin from Home Alone, that engaged in increased food intake, sleep changed, physical activity declined by 17 to 19 minutes. And so it really opened up a lot of individuals and organizations' eyes to the necessity for physical activity. So I believe the state is building the infrastructure to create more equitable physical activities in school and out of school. And we hope that in the next few years, we will be able to see that needle moving in the direction of more physical activity opportunities and participation.
Jordan, one other opportunity that I'm excited about is the evolution of technology and screens. So while we recognize this is both a major barrier to physical activity participation, I think there's been an evolution in thinking. We would love for children to go outside and play and engage in that really important unstructured free play. But with extreme weather variation and temperature and the challenges we have in some neighborhoods with perceived safety, and attention to the indoor physical activity opportunities at home, I think people are starting to recognize, are there games we can bring into the home to help the whole family be active together that don't require a lot of space? It used to be with technology, we mostly thought of children sitting in front of a large TV screen for hours on end, and that the screens have changed and they're now small and kids move around with the screens. They can potentially learn things educationally through the screens. And so to any extent, we can continue to advocate the industry and parents to look for ways to make technology and screens work for us instead of against us, to provide indoor physical activity options, as well as Jane's point about pay to play with sports. As we're trying to change sports participation to make it more accessible, less expensive, less competitive for some kids, as we're working on that, we also need to be thinking about other activity options that don't require signing up for a sports team. And again, that's where perhaps technology or some creative thinking about what kids are already spending time doing might help us to insert more physical activity into their daily lives.
I certainly second Amanda's point that we shouldn't limit our efforts here to the youth sports setting, but I do want to say that I think there are very important opportunities in the youth sports setting that can help us make progress here. I think the data that we report here shows that even though participation may have gone down some, a very large percentage of kids in the U.S. do participate in organized sport, and to me, that represents a real opportunity. It says what I think we know, which is that the platform exists in almost every community. I mean, there are programs in many communities, so many that it's hard to even catalog them all. So the platform is substantial. A concern that I've had, though, is that Part A is getting kids into the setting. Part B is ensuring that they're physically active while they're there. And I think traditionally, there's not been that much attention in the youth sports setting on optimizing the physical activity that kids engage in while they're there. And I do worry sometimes that parents kind of check the box. They sign their child up for a youth soccer program, and there's a practice on Wednesday night and a game on Saturday morning. And this group and the people, on this call today know that that's not going to add up to enough physical activity. But it's a start. And if we get them in that setting and then optimize the amount of physical activity they get while they're there, I think we can, kind of use this youth sports setting as a basis for real progress.
I want to take an opportunity to combine some of the indicators and see how we can work together. For example, the school's active transportation and the built environment. We know that active transportation is critical and can add the minutes of kids both walking and biking to school in the morning and in the afternoon. And the U.S. Department of Transportation with the infrastructure grants is a very unique way to build better infrastructure to promote the walking and biking. But some of the successful programs that we've seen, for example, University of Miami Miller School of Medicine, the Walk Safe and the Bike Safe program that teaches kids how to be safe while pedestrians and cycling, as well as DC public schools where every second grader learns to bike. So when we look at how to add more minutes to a child to reach that 60 minutes of physical activity daily, and we have talked about the before, during, and after school, the active transportation is another way in the community to get more kids moving. And it's a collaborative effort through education, Department of Transportation, the built environment, the community centers, and the comprehensive school physical activity programs. So working together and engaging all decision makers can make this happen, and we can move the needle on the next reiteration.
Jane, there's a couple of comments in or questions in the comment box around physical education. Can you tell us a little bit more about that and the need for daily PE?
Yes, I had to switch to my phone because the microphone stopped working on my computer. So there's a great need for daily physical education. And that's an easy way. That will help a child on their physical literacy journey throughout their life. We see a decline in the amount of daily physical education that students get as they progress from elementary to middle school and to senior high school. And daily physical education can fit into the day. The state of Florida has daily physical education 30 minutes a day for all elementary school children, but there's still just a 1 credit in high school, for example. But if the average student takes 24 credit hours to graduate high school, and many of those credit hours can now be achieved in middle school, and the average student will have at least 8 elective hours in high school that they can take additional, which doesn't take away from music or art, so they can continue with other interests as well as still get daily physical education. So if I didn't address it, I apologize. I can't see the questions on my phone. But if there's anything in particular, I can talk on physical education and the need for daily physical education till the sun comes up.
Well, I wanted to ask a follow-up to that, Jane, that's related to at least one or two other questions that came in. And so there's several folks in the group here today asking about how do we, not just, yes, physical activity or physical education is one of the answers here. How do we convince schools of this, school leaders, school administrators, even at the teacher level? Because there's so many things that schools are doing, right? And physical activity is so important, but so is everything else that schools are doing. So how do you really get that message through, or maybe what are some successes that you've seen in how schools have been able to buy into some of this?
The biggest thing is we need to amplify the message that physical activity enhances academic performance. And when principals are concerned with the letter of their school and how their school is doing on standardized tests and the students are doing, we have to amplify that message that physical activity not only enhances health benefits, but also enhances academic achievement. And we need to get the principals, as they're going through their principal training programs, they learn about the business of running schools, but not necessarily how individual subject areas can take on that support. And if they know how physical, we learned that we learned that with nutrition. We started feeding the kids on standardized test days and realized that when the kids were well fed, and thank heavens for the school nutrition program and breakfast program, kids do better when they're fed good nutrition, and they also do better when they're physically active. So we need the parents to engage in policy changes. We need to get community members, business leaders, and it also the importance of sports and building leadership. We haven't gotten the message out enough on the low scores on these indicators need to be reversed for a more healthier society. And it starts with our kids.
I would also add to that that in conversations with teachers and principals, we have to ensure that the physical activity meets their immediate needs. So immediate needs of classroom teachers right now, particularly for elementary school teachers, is behavior management. Since the pandemic, behavioral referrals to the principal's office, disruptive behavior has skyrocketed. And so teachers are looking for additional opportunities to help children manage their emotions so that they can get in that green learning zone, get out of the red zone, in the green learning zone so that they can pay attention in class and absorb that information so that you then see academic achievement. I think it's also important to be transparent with teachers and principals to let them know of the immediate benefits of physical activity. So a lot of the improvements in academic outcomes that we see, they come when there's changes in fitness, and that will take time. But you get an immediate boost in focus and attention as that BDNF goes up to your brain with movement, all that oxygen, blood, it is priming the brain for learning. It's helping children to manage their emotions, and it's getting the wiggles out. And those are three great things that teachers are looking for right now. For principals, they are looking at what are all those barriers. So I was just on a call with the principal this morning. I don't have enough space. So where are we going to put this? We don't have enough time in our curriculum. Classroom management skills. So thinking and having a really good understanding of what are teachers and principals up against, and then how can we come along and support them to meet their needs rather than our needs of physical activity. The principal asked me if I had a background in sales, and I said, no, I just believe in the drug that I'm selling. And I know that any problem that is encountered in a school, physical activity can be a part of that solution. But if we go into the school talking about health, we will catch the attention of the school nurse, but we may not catch the attention of the teacher because their priority is focused on learning, attention, and academic outcomes.
And I'd be remiss if we didn't say we also need to do a better job in addressing the needs of our youth with disabilities.
Yes.
We absolutely need more professional development for our physical education teachers. We need more certified physical education teachers in the schools. And a survey by Gen Youth with over 1,000 middle and high school kids across the country, they said they want more physical education and physical activity in the schools. So the kids are asking for more, so let's give them what they're asking for.
Yes.
And
And our classroom teachers are asking for it too. They just have so many barriers that it's great for us to work with implementation scientists to then understand what are those barriers and how do we overcome them. Sorry, Amanda, if I cut you off.
yeah, one example, alluding to what Jane was sharing earlier, in Louisiana, we've been working to align the physical activity and nutrition lessons with the ELA standards and some of the STEM standards as well. And that, of course, has really resonated with the teachers and the principals because then they don't see this as anything additional. And it's providing some content that will ultimately, like you said, Rebecca, help with classroom management and learning and so on, but really directly let them check off the box of what they need to be doing in the classroom through physical activity.
Yes.
So
And our kids were made to move. They can't sit for so many hours quietly doing desk work. They need to get up moving around. So classroom activity breaks are another critical and important component of how to add physical activity minutes to the school day.
And I think that's a very important point, Jane, because each component of the comprehensive school physical activity program highlights a different skill for children. So recess, free play, social emotional skills, learning how to just partner with other kids. That's a very different skill than in physical education where they're learning how to move. It's an actual curriculum developing these lifelong schools, whereas classroom physical activity is really there to prime the brain for learning. It's much more structured. It is not indoor recess. And I think it's important for us to understand what are the unique components of each of those programs, even if we bring sports back into it, all the different skills that kids learn around teams. It's important to have all of these different aspects or components of physical activity to help our children become successful adolescents and adults.
So some questions that have come in are about parents. So what can we do to support parents? And the question also mentioned a little bit about screen time as well. And so you could think about that as part of this question as well. How do we support parents? What do we do about screen time?
Of course, reminding parents that they are ultimate role models for their children, right? And even when you're thinking about motor skills and developing these fundamental skills that the children need to learn from others and engaging in the physical activity themselves, whether they are the ones that go out for a run and come back and their child see that the adults prioritizing physical activity in their lives, and then certainly whatever can be done as a family unit to be active together.
Yeah, our work has shown that kids who report that their parents are active with them and or their parents transport them to physical activity opportunities are more active than children who don't report that. So I think we've concluded that, well, first of all, to state the obvious, parental behaviors around physical activity are crucial. I think they're particularly helpful when they directly support the child's physical activity. I think if mom is physically active, that's probably a good thing. But we have not seen high correlations between parental physical activity and child physical activity, my speculation has long been that the parental modeling probably surfaces later in life when kids themselves become adults and they start, whether they're thinking about it or not, behaving the way their parents did. So I think it's all good, but I think when kids are kids, the parental support that is directly aimed at the child's activity is crucial. And while I'm speaking, I'll say, I think this is an example of an area where we need to take our intervention and communication efforts around physical activity really to the next level. I think we've invested a lot in trying to convince people that physical activity is important. I think we've won that battle. I think everybody knows that. And we have focused a lot of attention on the physical activity guideline, the target, and how much activity kids need, and so on. And that's okay. But I think it's time for us to be more sophisticated in these communication efforts. And in this setting, that an example of that would be public communication, education efforts aimed at parents with the focus on specific strategies, specific things that parents can do to promote their kids' physical activity. I don't think there are many parents out there that are, don't think their kids should be physically active, but I think there's probably a lot that many of them could learn about how to effectively do that, in their, personal home and neighborhood settings.
And one way they can get involved, of course, in a community setting, and we go back to the active transportation, is the walking school bus, the bike buses, how parents and community leaders can lead the charge in the morning and after school, and even going for a walk after dinner, talking about the school day when we talk about social emotional learning and parents being a part of their child's life and communicating with their child. Parents, caregivers, whoever's involved with that child, walking and talking is a great way to get in some movement for both intergenerational, even though we're talking about youth today. But it's a great way for parents to engage by just going for a walk after dinner.
I think another important thing to consider for parents is thinking about what are the values that they have for their child, and how can we use physical activity to meet those values. So what do I mean by this? During the pandemic, we as physical activity folks were really nervous about the decline in physical activity. But our parents were saying, well, I need my child to have more resilience. I saw a boost or a decline in my child's self-esteem. I saw that we need more love and belonging in our family. We don't know how to communicate together. And all physical activity can help to enhance each one of those skills. So in the state of Michigan Department of Education, along with our university, we developed a curriculum that's focused for parents. It's a family toolkit that aligns physical activity with Maslow's hierarchy of needs. So understanding what is their child's needs and how can physical activity help to meet that. As Russ said, giving specific tips. So developing physical activity calendars, partnering with Detroit Public Television to put physical activity on TV. In public television, because not everyone has access to internet. Not every parent is able to be at home with their child after school hours. So giving those resources to parents and children so that they can have some more autonomy in different types of activities that they can engage in is the way that we're trying to take on that approach. But I think, again, just like teachers, parents have a set of goals that they have for their kids. And if we can develop these multi-tiered systems of support for teachers like we do parents, I think we will also see more engagement at the parent level, and that is trickling down to the child. I think we'll also be able to see, as we increase physical activity at school, a trickle-up approach, as we saw with smoking cessation. When kids learned at school that smoking is bad, they went home and said, Mom, stop smoking. Grandma, stop smoking. And you saw some movement in smoking cessation increasing as a function of children being empowered, changing their behavior increasing that awareness that then leads to adult behavior. So I think we can use both approaches but we need to work together on a large scale. These small wins are great, but how do we scale these wins up so that we see national changes in physical activity participation?
And the resources that are available from Move Your Way on the Office of Disease Prevention, Health Promotion, those are free resources that we can, at least get the word out to parents, or ideas on how to get their kids and their families moving as well.
Great. I'm going to bring us to our last question since we have about 2 minutes left. So just want to thank everyone again for joining us. Thanks for spending this time with us today. And thanks so much to our great panelists. This has been a really fun discussion. We were able to get most of the questions answered. I'm sorry to those of you we weren't able to get your question answered. I just want to do one final remark from each panelist, just one sentence. What is your key takeaway or your key call to action? I'll start with mine. Mine is for everyone to think about and really consider how so many things in our communities that are typically considered not part of health services impact our children's health and development. So thinking about all the areas of our communities that impact health that are outside of the healthcare sector. And how can we better support those things to be supportive of our children's health? Who wants to go next?
To add to Jordan's point, when we look at physical activity patterns over the last 50 to 60 years, it's not leisure time physical activity that's changing, it's the environment that has changed quite a bit, and we have engineered physical activity out of our lives. But our solution has been to point to individuals and say, you need to take the initiative to get 60 minutes of physical activity into your kid's life. If we have systems change that took it out, we need systems change to put it back in.
And I'll follow that saying collaborative efforts and collaborative action, collective action. We can do this together. I can imagine a world where our kids are growing up healthy, strong, and happy. And together we can make this happen. And that's what I envision for the future.
It's a premise in public health that you deal with the issues that you monitor consistently. And I think our report card, kind of shows our current status. Certainly there's some strengths in the surveillance systems that we have available to, monitor the constructs that we're addressing here, but there's some big gaps. And, I just think we need to continue to work hard to create a more robust physical activity surveillance system in the U.S.
And to quickly add on to that, the last time physical activity levels were objectively monitored and for a nationally representative sample is over 15 years ago now. And we didn't touch on physical fitness, but it's an incomplete grade this year because there were no new cardiorespiratory or muscular fitness data available to us. So we need to advocate to better track the children's health so that we can create these targeted strategies and improve.
Well, thanks everyone for joining us. Have a great rest of your afternoon, and we look forward to continuing to work together, continuing this conversation and working together in the future on this critical topic. So thank you and bye everyone.